Hey, welcome to my channel. In this video we're going to talk about managing food allergies and also prescription medications. Please note this is different than drug allergy. That's a different conversation. We're not going to talk about it in this video. Also, I know that everyone knows this, but just to make it extremely clear, I'm not a medical professional. I'm an adult living with multiple anaphylactic food allergies and I've had them my entire life. And I'm just venting about it in this video, honestly. As part of advocacy is just like letting people know what it's actually like to live with this disease so that we can raise awareness. And I'm sure many of you will find this relatable if you or your kids have food allergies yourself. Prescription medications, this is a tricky thing, or it can be a tricky thing when you have anaphylactic food allergies. And I think it actually does depend what you are allergic to. Some adults with food allergies that I've spoken to have absolutely no problems with this. Others have huge problems with this, like myself. I'm allergic to dairy and soy, among other things, but those two ingredients seem to pop up as additives or fillers in medications pretty often, and that's what causes a problem for me. Other people I know who have completely different sets of allergens might have no problems with this because maybe their allergens aren't commonly used as fillers in prescriptions, and if that's the case, like, amazing that's great. Watch the video anyways, but like, that's great. So, if you've never thought about prescription medications and your food allergies, not to cause you anxiety, but maybe it's something that you should just consider, like have in the back of your head. Prescription and over-the-counter medications very often have some type of filler in them to create the pill or the capsule or whatever form it's coming in. And every medication that you purchase has some kind of leaflet or package inside that says what the ingredients are. For some, it's like a book, and for others, it's just a little description, but that's where you will find the information that I'm talking about in this video. It is so common for me to be prescribed something or to pick up an over-the-counter medication, and it has lactose or stearates, lactic acid, like various things that I'm allergic to and that I do not want to have an anaphylactic reaction to. So that brings me to my first point, which is that usually when these situations arise, a person is in a position where they need medication for something, so they're probably either sick or not doing too well, and it's already a point where you're feeling vulnerable, and really the last thing that you want to consider is this medication going to cause me to have an anaphylactic reaction? Not to the medication itself, but to the non-medicinal ingredients in the medication. It's kind of a stressful thing. I've been in situations where I actually have forgone the medication entirely because I was not able to get a clear answer on whether or not it was safe for me and my allergies. Food allergies are not always front of mind for everyone in the medical profession. Having to do like the calling manufacturer and doing this research into whether or not the medication is safe for you is just like a very heavy stress load for someone, especially like at times you might be ill and you might not be thinking clearly, you might be foggy, and having to go through this exercise is just a lot of pressure on patients. So I'll give you an example. I was so sick, I had been sick for weeks, and I went to my doctor and she prescribed me this inhaler, and I went to the pharmacy, picked it up. At that time, I just assumed that it was fine for me. I brought it home, and then, as I always do, I read the packet that came inside, and it said that there was milk powder in it. And I was like, now what do I do? I've already purchased this item. I've taken it home. I've seen my doctor. I went through that whole appointment. What do I do? And it really wasn't a great situation. And she also didn't know whether or not the dairy contained in that medication would cause anaphylaxis. So because of the uncertainty, it was just safer to forego it altogether. I'm adding this revision to say that I want to be extremely clear. I'm not suggesting that you just flippantly choose not to take medications that were prescribed to you, because that can also be super unsafe. You'll notice that in all of the examples described in this video, I discussed it with my doctor and we did the risk-benefit analysis and determined that it was safer for me not to take these medications. So I just don't want you to get the wrong idea and think that I am choosing independently to just not take something, because that could also be really dangerous. So please understand that distinction. I think it is important to empower yourself as a patient through education and information. So always get all of the available information that you can acquire before making a decision, and make it in conjunction with your doctor because they are able to help you. Another example a couple of years ago is that I was going through kind of a year of health nightmares. I really needed this prescription. I was actually excited to pick it up because I was having issues and I knew like this is gonna help me feel so much better. I spoke to the pharmacist about my allergies. She was like, Actually, the medication that you've been prescribed is flagged for both dairy and soy. So she ended up finding another alternative, and she told me to call into my doctor and ask if he can change the prescription. I picked it up, everything was great, and then on my way home, I was reading the leaflet, and it said that this was not safe for people with peanut allergies. I was like, great, now what do? I went through that whole rigmarole to get a new prescription. I had the pharmacist working overtime to find something that was safe for me. So I ended up calling my doctor, and he said, you know what, I don't know what to tell you. I think you just have to not take anything then, because there is no alternative for me to provide you. And it was a crushing feeling. And I do wonder, how many people does this happen to? I don't think we have any clear data on it, honestly. I don't know that this is actually something that people report to their allergist at all. I have never once mentioned it to my allergist, aside from the time when he had me do an oral challenge for a birth control pill in his office. That was the only time in my entire life that I've really mentioned food allergies and prescription medications and the challenges that I face. Other than that, I don't bother telling him because I don't think anything's really going to come of it. I don't know what he would do with that information. It might just get written in my file and then live there forever and just be a piece of information. It comes to one-off medications, if you have the flu, whatever the problem is, it just doesn't seem like a sustainable solution to go to your allergist to oral challenge it every time you need to take a prescription, especially because the turnaround of going to your allergist is probably not fast enough. I mean, we're generally used to having to wait for an appointment, and when you need something urgently, you can't really wait around for months in order to do that oral challenge. If you look at the statistics, in Canada, we only have about 200 allergists, but there are about 2 million people who identify themselves as having at least one allergen that they're managing. So the likelihood that people are actually telling their allergist about this every time it happens is pretty low, because I don't think everyone is seeing an allergist or even has access to an allergist. Hopefully watching this video will maybe bring it more front of mind for both pharmacists and allergists, and honestly anyone in the medical profession. I would love if there was more general food allergy education for pharmacists. Some pharmacists are extremely well educated about food allergies and have been able to really successfully help me over the years. When I was a teenager, I remember a pharmacist once telling me that, well, if you're lactose intolerant, just take Pepto-Bismol after you take your pills. And I was like, no, this is not it's not the same thing. Lactose intolerance and anaphylactic dairy allergy are two very different things, and I was so disappointed that I had to explain that to the same person who would sell me my EpiPen. A resource that has been extremely important to me over the last, honestly, my entire life, has been compounding pharmacies, compounding pharmacists. But there have been times when my pharmacist has told me, you know what, I can't get that ingredient in. There have been things like that over the years. And if you watch my rhinoplasty video, then you'll know that I had to have different medications compounded for that surgery, and that it was a challenge to get them in, and that the night before the surgery, I was freaking out because some of the medications didn't arrive in time, and they weren't sure if they were going to be able to get them for me. So compounding is a phenomenal resource, but it's not always a foolproof solution. But generally, I find my compounding pharmacist to be just this really, really incredible resource. It is more expensive, depends on what the medication is, because every medication has a different price point. But remember that you are paying for the labor for that pharmacist to construct all of your capsules or your pills. And something that I'm accustomed to doing as a person with food allergy is looking up the manufacturer's websites, looking up the pharmaceutical website, and finding all of the ingredient information for those pills, whatever it is. Sometimes I look out and there's a liquid solution that is safe for me. Usually kids take that. But hey, if it's safe for me, that's all that I care about. I do like the flavor of liquid medicine, so it's not a problem. I have such a great relationship with my compounding pharmacist. She even makes my supplements. She makes everything for me. It's anything that I could possibly need that I can't find in an over-the-counter format that is safe for me, or as a prescription that is safe for me. She's always like, don't worry, I can make this. And I'm like, okay. It will be okay. As a patient, it's really important that you advocate for yourself. When I was younger, I used to feel like, well, my doctor knows I have allergies, so Why would I have to tell her every time I see her? But the reality is that she has hundreds of patients, and every doctor sees so many patients. And if you look at your medical file, imagine they have that medical file for every single patient that they see. So I've learned that it's extremely important for me to reiterate my allergies every time I see her. Every time she pulls out a prescription pad, I have to remind her, can you check your book and see if what you're prescribing me is safe for me? Because sometimes she has access to a list of ingredients right there in her office, and then we can kind of sort it out before I even get to the pharmacy, and that's an ideal situation. You know, doctors are human. Like, she's not going to remember that I have all these food allergies every single time she sees me. I might not see her for a year. I might not see her for 2 years. When I go back to see her, she's not going to automatically know, oh yeah, I have to check the fillers in this medication. It's just not something that she's like programmed to think about. So it's my job as a patient to advocate for myself. Again, you may not see your pharmacist very often. You may go to a different pharmacy every time. You might have moved. Like, I don't know what your situation is. Just remind them. They will be able to look up that information. Then you can make educated decisions on what to do. And our job, we're our own biggest advocates. If you don't speak up for yourself, who else is going to speak up for you? Like, yes, I get it's so stressful. It can be extremely stressful. When I was younger, I was getting a test done, or I was supposed to get a test done to see if I had ulcers. I did not have ulcers, but anyways, I had to have this test done. I went into the room and the lights were off, and they told me to get into this, I don't even know what it was, thing, the x-ray. And then the nurse handed me this little cup of liquid, and she was like, here, drink this. And I looked at this cup of liquid and I was like, what is that? I have no idea what this is. So I asked her, what is this? May I please read the ingredients list before I consume it? And she got so frustrated with me because there were a million patients waiting in line and I was gumming up the system. And I was like, you know what would really gum up the system? If I had anaphylaxis right here in this room, and I don't want to go through that, and it's my job to take this really seriously, so I need you to get me the ingredients. And eventually she did locate the ingredients and she brought them over, and I read them and I said, thank you so much. Now I know that this is safe for me and I will proceed with the test. You're not always going to be people's best friend. You're not always going to be the sunshine that they want in their day, but you know what? You got to advocate for yourself. It's your job. There was a second test that I was supposed to do, and the liquid that they needed me to drink for that test actually did have some of my allergens in it, and I couldn't drink it and I couldn't do that test. So thank God I asked, because otherwise I could have ended up in a really bad situation. There's actually a guy behind the glass wall who is administering the test from afar, and he came on the mic and he was like, can you please drink this liquid now? And I said no, like, I will not drink it until I read the ingredients. I'm hopping over another revision, okay? I also just want to make it super clear that this video is intended to empower patients. It is so important to be empowered, to understand how to empower yourself, to not be afraid to speak up about your needs, even if it's inconvenient or if you're kind of annoying people. That's just part of it, okay? It's not always going to be easy. Work with the people who are available to help you. Your pharmacists, your nurses, your doctors, your whoever. It's not about working against them, or advocating should not necessarily be seen as a sign of protest. Advocating is just speaking up for yourself, feeling empowered, getting all of the education and information that you possibly can so that you can make the best decision with all that is available to you. And it's also not about sitting back and saying, well, I hope everyone else understands what I need, so I don't need to speak up for myself. That's not advocating. That's not the point of this video. Is to say, no, you speak up for yourself. Tell people what you need, be clear, communicate, educate others, get all the information that you need to educate yourself. Okay, we're not working against anyone. It's about working with people who are available to you, who can help you. So I want to close by saying, this is not something to have anxiety about. I don't want you to watch this video and go away thinking, oh my God, I never considered this before and now I'm panicking. This video is in no way, trashing medical professionals or pharmacists or nurses or the pharmaceutical industry, because those people are all extremely important in our lives as people with chronic illness, and they provide really valuable support for us, and it is important to appreciate that. And upon watching the video one more time, I thought maybe I didn't make that clear enough. Thanks so much for joining me for this video. I would really really love to hear your thoughts. Please comment on this video because I would like to get a discussion going. I know this was a super popular topic when I did a poll on Instagram, and I know that so many people wanted a video about this, and I hope that I answered what you wanted me to answer. I have no idea. Also, one of the main motivating factors behind this video was that I get so many questions from young girls or from moms of young girls who are like, how do you know if you can take birth control? Because so many birth control pills have dairy additives in them. And you know what? There's actually a post about this topic on my blog from a young woman who wasn't able to take them. And so everyone's situation is different. There's not one size fits all answer, but I will leave the link to that post in the description box of this video. You are free to check it out. And yeah, please let me know what you think. Let's start a discussion. Let's be very open about this, and let's communicate our needs as patients and empower ourselves to make the best decisions to suit our needs. Bye.